Welcome, everyone. Today I'll be discussing the Canadian healthcare system, providing a high-level overview of its structure, funding, delivery models, and key stakeholders. The Canadian healthcare system is unique in its approach to ensuring access to healthcare for all residents, and it operates under specific guiding principles that shape how care is being delivered. The Canadian healthcare system is primarily funded by public taxes, meaning all Canadian residents have access to medically necessary healthcare services without direct charges. Canada uses a single payer model where the government acts as a sole payer for essential services. This eliminates much of the administrative burden and makes the system more affordable for patients. The Canadian Health Care Act, or CHA, is a central piece of legislation that guides the system and ensures access to healthcare service across the country. We'll look at the Act in more details in the next slide. The Canadian Healthcare Act enshrines 5 principles that every province territory must follow to receive federal healthcare funding. The first is public administration. This means that healthcare system must be managed by public, non-for-profit authority. Comprehensiveness ensures that all medically necessary services, including hospitals and physician care, are covered. Universality requires that all insured residents have equal access to care. Portability allows residents to receive care in other provinces and even overseas. Accessibility guarantees that access to healthcare is not restricted by financial or physical barriers, ensuring everyone can receive care when they need it. Structure of the system. The Canadian healthcare system has a unique structure where both federal and provincial governments play important roles. The federal government provides funding to provinces and territories and enforces the CHA, while each province and territory administers and delivers services within its region. Because of this provincial administration, there are some regional variations in how services are provided. For example, some provinces may offer more extensive mental health or senior services than others, based on local needs and resources. Though the delivery of healthcare is collaborative, the federal government is solely responsible for the following groups of people: First Nation people living on reserves, the Inuit population, those serving members of the Canadian Forces, eligible veterans, inmates in federal penitentiaries, and some groups of refugee claimants. This is a list of the province, territory, and the health insurance programs throughout each province. Universal health care is often referred to as Medicare, which is why provinces such as Manitoba and Prince Edward Island healthcare plan is Medicare. Here in Ontario, where we are located, our healthcare plan is the Ontario Healthcare Plan, or often referred to as OHIP. Funding resources. Healthcare funding in Canada is primarily through general taxation, both federal and provincial. This pool tax money funds the majority of healthcare services. The federal government contributes through transfers to provinces and territories, which they use to administer healthcare in alignment with CHA. While the public system covers core healthcare services, many Canadians have private insurance for additional services not covered by public insurance, such as vision care, dental care, prescription drugs, ambulance services, and independent living. Looking at the delivery models. Canadian delivery models is tiered into primary, secondary, and tertiary care levels. Primary care includes family doctor or general practitioners, often the first point of contact for patients. Secondary care involves specialist consultations, such as cardiologists or dermatologists. Tertiary care refers to highly specialized services, often provided in hospitals like surgery or complex diagnostics. The single-payer model helps reduce administrative costs by simplifying billing and insurance processes, making it easier for patients and providers. In Canada, most hospitals are public and operated within the system, but private practices are common, especially for family doctors and specialists. Medically necessary models. Canada's healthcare system focuses on medically necessary service, meaning essential physician and hospital services are covered under public insurance. Non-essential services like cosmetic surgeries, elective procedures, and some complementary treatments are not covered. The system also places strong emphasis on preventative and acute care, supporting interventions that help prevent illness and treat urgent conditions. This helps improve population health while controlling cost. This is a graph at the public spending on healthcare across 32 nations. Canada Universal Healthcare System ranks number 13, highest on healthcare spending, at 7.5% of GDP, which covers about 73% of healthcare costs. Of the Commonwealth nation, looking at the overall healthcare system, Canada ranks number 9 out of 11 wealthy nations in healthcare spending. Insurance and complementary coverage. Private insurance primarily supplements services not covered by universal health care, like prescription drugs, dental care, and certain types of therapies. About 60% of Canadians have some form of private insurance, often provided through their employer, to help cover these costs. These complementary insurance helps patients access a broader range of healthcare services. Wait times and service allocation. One of the challenges in the healthcare system is wait times, especially for specialist consultation and elective procedures. Since the system is publicly funded, resources like specialist time, hospital beds, and equipment can be limited. This challenge is amplified in rural and remote settings. To manage this, healthcare providers use a triage system to prioritize urgent cases, especially in emergency departments. However, patients sometimes face longer waits for non-urgent treatment, which is an area of an ongoing improvement within our system. Interdisciplinary and team-based care. Canada's healthcare system is highly collaborative, with interdisciplinary team working together to provide patient care. Doctors, nurses, social workers, and specialists all play vital roles in the healthcare team, bringing diverse expertise to address each patient's needs. This team-based approach improves patient outcome and helps make care delivery more efficient, especially in complex cases that require multiple types of expertise. Looking at the roles and scope of nursing practice. Canada distinguished between registered nurses, which is RNs, and registered practical nurses, which is RPNs, also called licensed practical nurses, LPNs in some provinces. RN is a 4-year undergrad degree program, typically handling more complex patients and having a broader scope of practice, while the RPN is a 2-year certificate program which provides more routine care and is limited in scope of practice, particularly in managerial and leadership roles. Nurse practitioners, or NPs, are advanced trained nurses that can diagnose, prescribe, and manage patient care more independently. They often fill roles similar to primary care providers. The scope of practice differ in each province or territory. However, each role of nurse must be registered and licensed with their local, provincial, and territory regulatory body. Indigenous Health Service. It is important to understand the Indigenous care in Canadian healthcare system. The federal government also collaborates with province, territory, and Indigenous organizations to provide healthcare for Indigenous communities which face unique health challenges. There are increasing efforts to support Indigenous-led organizations which offer cultural sensitive care and address long-standing equities. This is a vital part of the system commitment to universal care, ensuring Indigenous communities receive accessibility and cultural appropriate health care. Prevention and public health focus. Canada places a high priority on preventative health care and public health initiatives. Agencies like Public Health Agency of Canada runs programs for vaccination, nutrition, exercise, and health education, aiming to improve long-term public health outcomes. Mental health and wellness have become significant areas of focus recently, with public and private programs to help manage mental health issues and access support services. Care. Over the years, the Canadian healthcare system has seen a shift in focus from hospital care to home care. Operating a hospital requires tremendous amount of money. Therefore, in order to cut costs, most provincial and territorial governments have reduced the number of hospitals. Home care was first created to provide care for people who needed at-home assistance after hospital discharge. However, today, home care and support wide range of people that includes older people, families with children, people who are living with mental, physical, and development disabilities, people with long-term and short-term medical condition, and people in the recovery, rehabilitation, and final stages of life-ending diseases. One major focus of home care is to enable people to remain in their homes so they can be as healthy as possible and remain independent for as long as possible. Additionally, due to the client staying in the hospital for shorter time, patient outcome has improved, as complications of prolonged hospitalization has lessened, for example, hospital-acquired infections. Eligibility and hours of services provided will also vary depending on the province and territory and can be supplemented with private coverage. Long-term care, also known as nursing home, personal care homes, residential care facilities, lodges, assisted living facility, and supportive housing. Long-term care are community-based facilities that provide ongoing professional services to individuals with complex health who may not be ready for discharge from the hospital but who no longer needs an acute care setting. Long-term care encompasses a range of health and personal care services provided for individuals with complex medical needs. It is a place where they live and receive care at the facility. The interprofessional team includes nurses, nurse practitioner, doctor, personal support worker, social worker, recreational therapist, and etc. Although the Canadian Healthcare Act does not include long-term care as an insured health service, it must be publicly insured by the province and territories. To qualify for federal funds, all jurisdictions have allocated some public funds to long-term care. Long-term care homes also require residents to contribute towards the cost of accommodation and meal. This is called a co-payment plan. The amount of co-payment fee is based on whether someone is in a basic, semi-private, or private room. Key stakeholders in the system. The main stakeholders in the Canadian healthcare system include the federal and provincial government, which set policies and manage funding, healthcare providers who deliver care to patients, and patients themselves who are the center of the decisions. Community organizations also play a big role, especially in rural and remote areas, where they provide essential support services and advocate for healthcare improvement tailored to the community needs. Policy implications. According to the Social Determinants of Health, the Canadian Facts 2nd edition, these 5 policy implications are recommended on how policymakers can improve the Canadian healthcare system. The first is directing attention to existing inequality in access to healthcare and removing barriers. The second is implementing a pharmacare program and increasing public coverage for home care and nursing home costs. The third is the Medicare system should be strengthened and the halt of increasing involvement for private companies. Fourth is controlling the cost of costly, ineffective treatments. And the fifth is consideration should be given to providing dental care for families living in low income. Summary. Canada's healthcare system is publicly funded single-payer model rooted in the CHA's 5 guiding principles. The system structure involves federal and provincial collaboration, with province administering services funded by both federal and provincial taxes. While private insurance fills some coverage gap, the focus remains on primary and preventative care, supported by an interdisciplinary team to provide comprehensive care. Canada's healthcare system is built on principles of equity and accessibility, aiming to provide comprehensive publicly funded healthcare to all Canadians. However, it is not without challenges, including wait times, cost containment, and accessibility issues. Despite its complexity, Canadians generally value their healthcare system as an essential public good that is accessible regardless of income or social status. This brings us to the end of our presentation.